Do you ever feel like you're on the outside looking in, disconnected from the world around you? This feeling of disconnection is not uncommon, but for some it's a way of life. Welcome to the world of schizoid personality disorder, a complex and often misunderstood condition that affects millions of people worldwide. In this video, we'll delve into the symptoms, causes, and treatment options for those struggling with this unique and challenging disorder. Namaste, exploring the mind together. Schizoid personality disorder is a complex and enigmatic mental disorder that affects an individual's ability to form meaningful social relationships and engage in normal social activities. The condition is characterized by a persistent pattern of detachment from social relationships and a lack of emotional expressiveness, as well as a tendency to be introverted, solitary, and emotionally cold. The exact causes of SPD are not yet known, but it is believed to result from a combination of genetic, environmental, and psychological factors. It is estimated that between 0.5% and 1% of the general population suffers from SPD, and it is more common in men than in women. Schizoid personality disorder is often confused with schizophrenia and autism spectrum disorder. However, these are different conditions and have distinct symptoms and treatments. SPD is characterized by a lack of interest in social relationships and a tendency towards solitary activities, while schizophrenia involves symptoms such as delusions, hallucinations, and disordered thinking. And autism spectrum disorder is characterized by difficulties with social interaction, communication, and repetitive behaviors. It's important to have a proper evaluation by a mental health professional for a correct diagnosis. They may also be preoccupied with their own thoughts and experiences and be indifferent to the feelings of others. Diagnosis of SPD is made through a clinical evaluation by a mental health professional, who will consider the person's symptoms, medical history, and family history. Research has suggested that early life stress and traumatic experiences may play a role in the development of schizoid personality disorder. The diagnosis may be supported by a psychological assessment, such as a standardized questionnaire, to assess the person's social and emotional functioning. Treatment of SPD typically involves a combination of psychotherapy and medication. Psychotherapy may include cognitive behavioral therapy to help the person learn how to better understand and manage their emotions and improve their interpersonal relationships. Medications, such as antidepressants, may also be prescribed to help alleviate symptoms of depression or anxiety that may be associated with SPD. People with SPD can benefit from therapy that helps them learn to express their emotions and develop better social skills. They can also benefit from support from family and friends who understand their condition and are willing to offer help and encouragement. Self-help tips. Experiment with social activities, such as volunteering or joining a club, to find new interests and connect with others. Focus on self-expression. Engage in creative pursuits, such as writing or painting, to find new ways of expressing yourself and connecting with others. Build small relationships. Start small by making casual conversation with people, such as co-workers or acquaintances, and work on building trust and rapport. Practice empathy. Try to understand the feelings and perspectives of others, and express empathy to strengthen your relationships. SPD is a complex and often misunderstood disorder that can have a significant impact on a person's ability to form meaningful relationships and engage in normal social activities. Early recognition and treatment are crucial to improving the person's quality of life and helping them to reach their full potential. Dr. Latifah was with you. See you in the happy future.